I, Nikhil Kulkarni from Batch 6, is highly privileged to present project on trending COVID-19 done by my fellow friends of Batch 6 from roll number 76 to 90. Contribution to the project noted by Nagendra Babu. History of coronavirus presented by Nimra. Coronavirus are a group of RNA virus that cause diseases in mammals and birds and respiratory tract infection in human. Most recently, COVID-19. Coronavirus evolved in 1930s and 1960s. Latest coronavirus was detected in Wuhan's wet market in 2020. In wet market, fresh meat and fish are killed on spot and sold. Scenario of COVID-19 at world, country and state level presented by Arif. If someone asks me what is the biggest crisis after the World War II, my answer straightforward would be coronavirus pandemic because 15 million people and more are getting affected by pandemic and 6 lakh people have died worldwide. Here we can see most affected countries in world. First USA, second Brazil, third India. India's current situation as on 20th July, there were 1 million confirmed cases and 28,000 deaths. Number is increasing day by day. Coronavirus outbreak in India on July 21 as per Health Ministry. Maharashtra, Tamil Nadu, Delhi remains the worst affected states. Recently, Karnataka has moved to third position. Pathophysiology of coronavirus presented by Neha. Coronavirus is single-stranded RNA virus. It affects our respiratory system and acts as major pathogen. Cause of coronavirus. Most commonly, it is spread from person to person among those in close contact by respiratory droplets during sneezing, coughing and talking. Effect of coronavirus. It accounts for common cold and its effect on respiratory epithelium is asymptomatic. Corona and symptom relation presented by Nikhil. During moderate symptoms of corona, macrophages releases cytokinins and fight against it. But during severe symptoms, there is cytokinin storm causing overinflammation, leading to destruction of lung tissue, causing severe acute respiratory syndrome, hence suppressing our immune system. Let us see symptoms of COVID-19 presented by Nabi Rasool. Common symptoms are fever, cough, sore throat, and difficulty in breathing. Early symptoms include loss of taste or smell, muscle ache, chill, runny nose, headache, and chest pain. Appearance is 7 to 14 days after exposure, range is from mild to severe. Some may have few symptoms, some may have no symptoms. Tests for COVID-19 include diagnostic test and antibody test. Diagnostic tests include molecular tests, which include amplifying and interpreting through primes of COVID-19. Antibody tests include detection through capillary flow of antibodies and noting the color change when exposed to COVID antigen. Vaccine trials around the world and India presented by Nitish and Muzaffar. In simple word, vaccine resembles microorganisms which stimulate antibody production against disease in our body. Vaccine is tested in following phase: preclinical, phase 1, phase 2, phase 3 and approval. Preclinical testing involves animals. Phase 1 involves small number of people. Phase 2 involves 100 people. Phase 3 1000 people. Vaccine is given in all these 4 trials and based on that country approves it. Vaccine may receive emergency use. Recently, 150 companies are doing trials. Among those, Oxford University's vaccine is producing promising results and hope it get approved soon. Prevention and control presented by Mustaq and Musab. To prevent COVID-19, avoid close contact with people, avoid touching your face, practice social distancing, wash hands often with sanitizer and wear face mask. Control measure for ill people. Stay at home, stay isolated. When coughing and sneezing, cover your mouth the way the girl has portrayed in the picture. Lastly, monitor everybody's health. After mentioning the do's, don'ts are having close contact with sick, touching your face oftenly, spitting in public. All these 3 must be prohibited. Role of Corona Warriors presented by Nooren. Frontline warriors are doctors, nurses, pathologists, and pharmacists, etc. Second line Corona warriors are police, NGO, and ASHA workers. They help us in prevention of COVID and take care of our doctors too. One can become a warrior of corona by supplying essential to needy and by taking all precautions. Group motivational message presented by Omkar. Every person is a soldier in this battle and also leading the battle. A big salute to Corona warriors. If I could offer advice to any family today, it would be to stick by your faith, know that your God is with you and will take care of you all the way through. Thank you. Presentation edited by Oama and Suhail. We thank Swati ma'am for giving us this wonderful opportunity. It not only helped us to gain knowledge of ongoing pandemic, but also fight against it with unity. Once again, thank you very much.